Hi, I'm Adrian, and I'm here with Dr. George Szonyi, and we're here to talk about interview techniques for medical interviews. Could you tell me a little bit about yourself?
Yes, my name's Dr. George Szonyi. I'm the head of geriatric medicine at Royal Prince Alfred Hospital. I've been doing that role for quite a long time now. I have been involved in interviews, so I often will interview for staff specialist geriatricians to work in our department as our department is getting bigger. And I've also been involved with other staff specialist interviews and visiting medical officer interviews and also career medical officer interviews. I sit on the Medical Dental Appointments Advisory Committee where appointments are discussed.
So what advice would you have for people that are preparing for an interview?
Okay, so basically there are three things you have to think of. What do you do before you apply for the job, applying for the job, and then actually coming to the interview? So before you apply for the job, you need to try and work out what sort of job you want to do. You need to have some sort of career goals. If you've got a particular interest, you then need to let people know about that interest and let them know that you're looking at, say, perhaps becoming a medical registrar. Talk to your supervisors at the different terms and help them prepare you for the next step in your career. So that's the first part of it. The second part of it is when you're actually writing your application for the position, you need to look at the questions that are being asked and answer them comprehensively. Make sure that you've got a good CV. You're going to need referees that are going to support you, so you want to get your referees on side well in advance of the interview and try and get in their good books, work out strategies of how to impress them so that they can rave about you after the interview if you're going to be successful. And the third part is preparing for the interview. Once you have been accepted to come for an interview or once you've applied for a job, you need to familiarise yourself with the position you're applying for. It may mean contacting the department, coming and have a look, showing some interest even prior to the interview. So the more you understand about the position you're applying for, the more likely you're going to answer the questions they want to ask you about the particular job in the interview. So it's important to do the groundwork first.
Great.
With the actual interview itself, there are quite a few standard type questions. It's worthwhile to think about what sort of answers you're going to provide at the interview. Try and link to personal experiences that you've had. Think about what are some of the things that you could talk about, including strengths, weaknesses, why you've applied for the job. And the more you prepare, you might even practice with some colleagues, the more likely you're going to perform better at the interview. Mm-hmm. The interviews tend to be fairly standard. So it's normally last about 20 minutes. You have about 5 to 7 questions and everybody gets asked the same questions. Sometimes they will expand a question. So it's just a matter of how well you can answer those questions, and that the interview does carry a big part as to whether or not you're going to be successful in the job.
And what do you actually look for in a candidate?
Often you can tell fairly early on if someone's doing well, a good understanding of the position that they're applying for, someone who can sell themselves. Main things we look for is honesty, enthusiasm, excellent interpersonal skills, ability to know your limitations, ability to know when to ask for help, someone who follows procedures and processes, someone who's experienced and has had the clinical exposure to do the job you're looking for, someone with initiative, drive, those sort of things.
And I understand you ask a lot of interviewees, or I've heard this question a lot around, what are your weaknesses? How would you suggest people approach that question?
You have to be honest and you have to come up with weaknesses that you can demonstrate that you're working on to improve, or weaknesses that the interviewer can relate to. So for example, you might have a weakness such as public speaking. You might get nervous in public speaking. Then if you're going to use that as an example, then you need to tell them, well, what are you doing to address that? So you might, that's one thing I used to get nervous with when I was public speaking. You still get a bit nervous, and I found the best way to deal with that is to know your subject thoroughly, practice well in advance, and then you could say you've done some presentations, such as you might have done some grand round presentations as examples of how you're dealing with that situation.
Yeah, that's very good. You need to be introspective. You mentioned your own weaknesses, talking too loud or talking too quickly. A lot of that falls under the umbrella of communication skills. How is that assessed in an interview? Are you specifically looking for that in a candidate?
Yeah, clearly. So if someone has got poor communication skills, you're not going to want to employ them ahead of someone who's got good communication skills. You can often work out whether someone's got good communication skills, how they present in the interview themselves. And a lot of people will say that, well, it's probably useful to say you've got good communication skills.
Well, what are you exactly listening for in an answer? What stands out as this is a good communicator?
Well, someone who is precise, can put their point across in a way that you can understand. They don't waffle. They answer the question, that they're appropriate, and you can understand them.
What do you think is the part that people struggle the most with for the interview process?
I think part of it is selling themselves, highlighting their strengths in a convincing manner, and getting stuck down on theoretical answers, implying that they haven't actually been involved in that situation. Mm. So it's much better to demonstrate that you've been there, you've done that, you've worked out how to do it better. That's what people probably struggle with the most.
Great. And so what normally happens after the interview's over?
Normally after an interview, I mean, it depends how many applicants you're looking for. If in the case of a staff specialist, we might only be looking for one applicant for a position. Normally the preferred applicant, at the interview, everybody takes notes during the interview. We compare answers. The panel sit down and rank the candidates in order. They work out who is employable and who is not employable. And then based on that order, normally the convener would contact the referees of the preferred applicant. So the other people's referees aren't usually contacted unless you're having difficulty deciding between two applicants. And if the referees are appropriate, in the case of senior staff, well then a recommendation goes to the Medical Dental Appointments Committee, and then that has to be signed off by the CEO. In the case of registrars, it would be a lot simpler. And they may well be contacting multiple referees, depending on how many people they want to employ. The people, they're not going to contact everybody's referees. They're only going to, if they've decided on 10 applicants for 10 jobs, then they'll contact 10 referees. If they're unsure about the 10th applicant and they might be tossing up between a 10th or 11th applicant, well then they'll contact the referees of those two. So if your referees haven't been contacted within about a week after the interview, that's a pretty good idea that you're not going to get the job.
Right, fair enough. And now I want to hear about your own personal experiences being interviewed yourself. Is there anything that comes to mind? Are there any challenges that you had when you were being interviewed?
Luckily, I haven't had to apply for a job lately. I occasionally get interviewed for head of department positions. I remember when I was applying for jobs, I didn't always get the job I wanted. That was quite a few years ago. I was fairly nervous, didn't answer the questions as well as I could.
Is there anything that stands out that you obviously know now that you would love to have told yourself when first preparing for those interviews?
Well, I think I'd just have to sell yourself a bit better. Over the years I've learnt that saying more is better than just having short, brief answers. You need to answer the question, you need to demonstrate you've got the experience, you need to sell yourself, you need to convince them that you're the best applicant. It can be difficult if you're an outsider applying for a job, because often the people they know that's working in that particular hospital, for example, will have preference. So it's a lot harder if you've got internal applicants to try and get a job.
Great.
And sometimes it all boils down to luck.
Thank you for that, and thanks for your feedback on the interview process. We prepared some mock questions that we would love to hear your feedback on, and there'll be a link to that in the description of this video.